will be on the describing healthcare technology management practices in the procurement of medical devices in Dr. Kenneth Kaunda district. As you can see that my name is Pule Mogorosi. I'm a clinical engineer by profession, specializing in healthcare technology management. The order of the presentation will be as follows: the introduction, the objective, and the research question, methodology, theoretical framework, focusing on the procurement of medical devices. The results will be analyzed and discussed, and the recommendation will be made and conclusion along with the references. Introduction. The significance of HTM lies in its provision of scientific and technological support for medical devices and clinical information system, and its promotion on financial accountability. This is important because technology is indispensable in healthcare system. Hence, we can see that without medical devices, many procedures will be unfeasible. Effective technology management is pivotal for public and private hospitals, as this is a significant proportion of their budget tends to move into the medical devices. Numerous studies underscore the absence of essential medical devices in low and middle income countries. Then moving to the objectives and the research questions, I had one primary objective, which is to describe the HTM practices focusing on principles used by healthcare technology personnel, looking at the procurement and their technical department when planning and procuring medical devices in Dr. Kenneth Kaunda. The secondary objectives, I had two. One was to describe the procurement strategies focusing on healthcare technology management principles, including need assessment, specification, and standard adherence, technology assessment, cost analysis, and comprehensive lifecycle management. And the second one was to propose the methods of prioritizing medical devices, procurement to strengthen healthcare systems, and balancing cost-effective, looking at the safety and the efficacy. And the most important part was the research questions, which was how are HTM principles applied when purchasing medical devices for public sector healthcare facilities in Dr. Kenneth Kaunda, South Africa. And the methodology. A qualitative research approach was deployed and a stratified sampling was used so that we can actually look into the strategic and the operational perspective of this research. The research employed the semi-structured interviews, carefully constructing a balanced controlled inquiry, looking at the participant viewpoints and the first-hand knowledge in depth. The intention was to interview 13 participants, but the saturation was reached. Looking at the fifth interview, and just to solidify the findings, we ended up moving to the sixth participants. All participants willingly participated and provided valuable contributions. Neither the researcher nor the participant had prior knowledge of each other before the study. Then moving to the theoretical framework, which we will be focusing on the procurement of medical devices. A comprehensive approach to healthcare delivery considers how medical devices regulation influence procurement at the macro level, how procurement regulations aligns with the clinical practice, looking at the meso level, and how procurement practices impact the clinical outcome at the micro level. These illustration actually looking at the conceptual framework designed for high-risk medical devices, but anyway, you can also deploy them for specific needs for any healthcare facilities. And obviously, adhering to these stringent procurement restrictions may harm healthcare delivery. Hence, it is important to establish regulations and align the efficacy and obviously provide optimal healthcare provision. Now, looking at the results and the analysis, looking at the discussion itself, I had to split this two so that it can make more sense. I'm going to start with the strategic strata. In the strategic strata of the HTM, participant 1, 2, and 3 offered an insight into the procurement of medical devices, covering the spectrum from the initial planning to post-procurement activities. This group consisted of various individuals looking at the age group of 22 to 55, with the cumulative experience of 42 years. And the qualification was between national diploma and postgraduate degrees. Their expertise encompasses technical understanding and administrative skills, promoting a comprehensive and proactive approach. At the core of the strategic layer is a forward-thinking perspective, obviously looking at the complex requirements of healthcare providers and focus and the strategic crafting to meet the present needs and the anticipation of future demands. Now moving to the operational strata. The operational strata of the HTM practices, as detailed by participant 04, 05, and 06, spotlights the day-to-day intricacies involved in the procurement of medical devices. They presented the segment underscores, which was focusing on the critical aspects such as asset management and maintaining quality assurance throughout the procurement cycle. The age group was between 38 and 55 with a total experience of 47, and the qualification was between National Diploma and BTech. The operational stratum narrative is illustrating that despite the myriad operational challenges, their dedication is evident in the depth navigation through the complexity of lifecycle management, ensuring that each medical device operates optimally until its lifespan. Then participant 01 to 3, we extracted 32 distinct images. These codes were organized in 8 overarching themes, offering a framework of understanding the district HCM practices, as you can see on the right-hand side there. This organization allowed us to structure the inside of the strategic layer approach so that the medical equipment can be categorized properly. The table presents these themes and codes as interconnected elements that form a picture of a landscape of HTM in Dr. Kenneth Kaunda. Then from the operational structure representing participants 04, 05, and 06, 25 distinct codes were extracted. The codes were organized into 9 overarching themes, and the challenges and the areas of improvement were identified, drawing upon the insight from participants 04, 05, and 06. HTM practices within Dr. KK revealed a pragmatic focus on the navigating day-to-day complexity of medical equipment, looking at the discussions of the observation. The interface between operational excellence and strategic foresight represents a critical nexus in HTM practices, facilitating an intricate and a pivotal collaboration dynamic. The interaction between strategic planning and operational realities is a reciprocal relationship crucial for improving HTM practices in Dr. Kenneth Kaunda. In the context, the strategic layer approach to the selecting of medical equipment complemented the operational layer's rigorous management on these medical devices. Such an approach ensures the sustainability and resilience of HTM practices in low and middle income countries. Then the theme on looking at the committee decision-making and the association code holistic evaluation emerged prominently, highlighting the value placed of comprehensive and inclusive approaches at decision-making. And the interview insight underscored the critical importance of integrating a broad spectrum. And this integration approach is pivotal in ensuring that procurement of medical devices aligns with the overarching goals of the enhancing healthcare delivery, looking at Dr. Kenneth Kaunda. Then these are the results. The analysis conducted within Dr. KK has illustrated that multifaceted challenges and opportunities that refine the current state of HTM, and this was done by examining strategic and operational perspective. The study has unearthed critical insight into medical devices procurement, revealing a landscape marked by procedural dichotomies, policy gaps, and complex operational realities. This model encompasses rigorous policy formulation, effective lifecycle management, and the approach was critical for addressing the nuisance challenges of medical devices procurement and ensuring that infrastructure is well looked after and aligned with the evolving needs of the patient population. And the following emphasis are imperative to note for the study: procurement strategic and HTA principle. The study detailed procurement strategies encompassing needs assessment, specification, and standard adherence, technology assessment, cost analysis, and obviously aligning with healthcare facilities' actual needs and operational realities. Cost-effective discrepancies, the research pinpointed notable gap between the knowledge importance of cost-effective in procurement practices and its practical implementation within the district. Then prioritization methodology, the study proposed methodology of prioritizing medical equipment procurement, emphasizing the balance between cost effectiveness, technological safety, and efficacy. These methodologies will definitely strengthen the healthcare system, looking at Dr. Kenneth Kaunda. And these are the recommendations that were extracted from the study, that the district must establish a dedicated health technology committee and this will enhance their strategic planning. And obviously, a policy must be developed so that they can know what needs to be bought, when, and how. And obviously, the strengthening cost effectiveness analysis is supposed to be in place, integrating technology assessment, and they need to foster continuous training and capacity building so that their employees are well equipped and know what needs to be bought. And this recommendation aim to forge a fourth and forward-thinking, efficient, and patient-centered HTM system, ultimately improving healthcare outcome for the community it serves. And in conclusion, while addressing the core research question, it became evident that the application of HTM principle in the procurement of medical devices is at times overshadowed by immediate needs and budget constraints. This situation highlights the necessity for a strategic alignment towards a more comprehensive, driven approach of HTM principle. Such an approach will enhance the efficiency and effectiveness of healthcare delivery and ensure that procurement decisions are made with a long-term perspective on patient care and system sustainability. And the study, while inclusive, acknowledges its limitations and views, looking at the avenue for future research by embracing a proactive and strategic approach to HTM practices. Dr. Kenneth Kaunda District can navigate the complexity of modern healthcare landscape, ensuring that its facility and equipped to meet the evolving needs of its population with efficiency and compassion. The path forward is marked by collaborative efforts of all stakeholders, united in their commitment to elevating healthcare standards and fostering a future where principles of HTM informed their decisions. And these are my references. I would like to stop here. Thank you very much.